Okay, and the final talk today is from Grania, who's going to, many of you will have met Grania in the clinic. Grania's going to talk about fatigue and about, again, it harps back to some of the questionnaires that you've also kindly filled in. So over to you, Grania.
Okay, so I hope you can hear me at the back. This part of the talk has been very much driven by yourselves, and the whole issue of fatigue is what you have been telling us about in the clinic. And it's something that appears to be quite common, but has not been extensively researched or looked at in the past. As you're all aware, for those of you that suffer from it, it interferes with your ability to do day-to-day activities, from housework, but also to performing work, and also from, in cases, taking up meaningful employment. The severity of your fatigue doesn't always correlate with the impact on your day-to-day functioning. So some people can have very severe fatigue, but able to continue to work. The cause to date is unknown. We don't know why people get such severe and debilitating fatigue in mitochondrial disease. And as I said, it hasn't been extensively looked at. Why would we want to look at it? Well, one, because it is such a common symptom. It is having a significant impact, but also potentially there may be treatment for it, and that's what's probably quite exciting about this area. As quite a few of you are aware, we forwarded you quite a big pack of questionnaires, and within that pack of questionnaires there was quite a significant or thick one which actually related to fatigue. The first part of the questionnaire was to identify whether you had fatigue or not. The second part of it was to identify the significance and the severity of the fatigue and the impact it was having on your day-to-day life. And the last part was potentially to look at potential causes that we might actually be able to identify on a questionnaire, that then would allow us to look further or down the road of potential therapies for it. To date, we've sent out 228 questionnaires. We've had back just over 130, and myself and Mark have just analysed approximately 100 of them for today's talk. The first part of the questionnaire was to look at, to identify if you had fatigue or not. And as I said, there was 9 statements within that questionnaire where you rated your degree of fatigue from 1 to 7 and its impact in different parts of your day-to-day life. That looked at severity, the frequency and impact, and significantly over 70% of those that have completed the questionnaire actually suffer from severe fatigue. From the questionnaire, if you score over 36, when we put the questionnaire together, you've got severe fatigue. The average score for the 100 that we've analysed to date is actually 59, so it's almost double what the questionnaire itself would rate severe fatigue. So fatigue is extremely significant within the mitochondrial population, and it's something that we really do need to look at. So we know it's severe, but what might the causes be? And that's the second part, or the bulk of the questionnaires might give us a clue to. So what normally causes fatigue? Well, quite often with other conditions, it may be related to a sleep disorder or sleep problem. That does not appear to be the problem or the cause when we look at the questionnaire feedback. Could it be related to anxiety, which is known in the past to impact on fatigue in other conditions? That is not the case here. Could it be related to low mood? And again, that would not appear to be the case here. So those common causes in other conditions like a sleep disorder, anxiety or depression are not the actual causes within the mitochondrial population. Could it actually relate to the mitochondrial condition? And this is really going back to what Professor Turnbull would relate. The mitochondria are essentially the batteries of the cells. Could this actually be battery failure, mitochondrial failure? And we suspect that is possibly a part of the cause. But something else that seems to be turning up from the feedback from the questionnaires, that it's not just to do with battery failure, but it's also to do with other things, and even down to how your body controls your blood pressure. That's sort of simplifying what it is, but that would appear to be something that's coming through and would need to be further looked at. And it's actually quite exciting because it has been looked at in other conditions where mitochondrial dysfunction has been a secondary thing, so it's not the main cause of the condition, but it also is part of the problem with the condition. So this is something that we will possibly look at. And why would we do it? Ultimately, because potentially we might be able to help. If fatigue is so debilitating that it's impacting on everything that you do from day to day, and as you hear, it also has implications from benefits point of view, it's important that we not only look at, say that you have fatigue, look at the causes, but also potentially look at treatments. And this may be simple things from diet to medications, or as in our group we're looking at potentially the effects of exercise may actually help fatigue. I'd like to say thank you to all of those who have completed these questionnaire packs, because we know that they were quite extensive and quite arduous, but hopefully you've got a feel that we are looking at the information and it is actually providing quite useful information, and really it's ultimately not just to document that it's a problem but also to potentially help. Thank you.
Thank you very much, Granny. I think it is something that we get a lot of people. I mean, let's just say in normal life, a lot of people who are healthy actually complain about fatigue. But this is a lot more, isn't it? Because of the numbers, it's much higher.
This is when you talk about fatigue that we do medically, you're talking about excessive fatigue, and also 70% is extremely high for any condition. It's sort of one of the highest values that I can see looking at the literature for most of the conditions that people would attend a doctor for.
Okay. And what you're actually suggesting is, if we understand a little bit more about the cause of the fatigue, we might be able to make some suggestions which will actually help. That's correct, is it? Yeah?
Absolutely. To fundamentally, hopefully, to get a potential treatment or help if we had a better understanding of the underlying causes, because hopefully you see that there's so many potential causes. Where would you start to treat? But already from 100 questionnaires, we seem to be able to tease out what might be potentially contributing to the fatigue. And
do you feel it might be different things for different people, again, which is why it's important that we look at each patient independently?
Absolutely. I think when you look at everything overall, everyone may have different causes, but if there's like a common theme or potential causes that we could look at from simple things, as I've shown you, it could be simple things just like diet. And that's like literally increasing the salt in your diet may be a potential help. And that's not like putting the salt, back on the table. It's even from changing your cereal in the morning to bran flakes, which has higher salt content, or eating more tomatoes, which have a higher salt content. So, it could be simple measures right down to then more complicated things like medication.
Okay. I think that's very helpful, and it just kind of stresses the way in which, coming back to what Dr. McFarlane was saying about research actually hopefully benefiting you as patients. Are there any questions that people want to ask? Again? Okay. Thank you very much, Grania. We're particularly grateful for Grania for actually coming in so soon after childbirth, so thank you very much.